What are some of those early signs and symptoms of mental health conditions that people often overlook? Because Nigerians now sometimes, not even only Nigerians, almost everywhere, when something is not severe, when it's not so serious, they don't tend to, want to seek medical help until it gets to a stage that it is you can't control it anymore. So I would like you to tell us, and of course tell the audience as well, what are those early signs of mental health conditions or mental health challenges that people should look out for, that when you are showing these signs or when you are noticing some of these things, you should see a psychiatrist or a psychologist or therapist ASAP.
All right, yeah, so thank you, Evening. So, first off, mental health signs are numerous, right? But then, for the basic of, the commonest mental illness that we have, which is often depression, anxiety, and all of that. So, yeah, for the mental health signs that you should look out for, especially when you're presenting with depression, would be anhedonia, what we call anhedonia. So, when an individual who loves to do things stop getting interest in those things that, used to like be the spark in his or her life, right? So more like, for example, now, let me take myself for example. So I like to probably read, right? And all of a sudden, I don't feel like reading anymore. Even when I know that I have an exam that I need to write, but there's no interest to read. And I'm noticing that, okay, I feel easily fatigued. So maybe, obviously, everybody knows that I am very hyperactive, right? And all of a sudden, the whole...
You're everywhere.
I'm everywhere, you guess, right? So all of a sudden, I'm not everywhere anymore. So people are looking like, oh, what's going on with this girl? So that's something to look out for. And then maybe you start losing interest in eating. That's loss of appetite. Or for those ones that used to be very intentional about what they eat, they start eating too much, start sleeping too much. For me now, that love to eat. So imagine me not eating again. Even myself, but if I notice that I'm not eating, I know that there's a problem. This is not me. This is not like Zina. Me that like. So you understand? Those are the things that you should look out for, like eating those things that you love doing before, and all of a sudden you are losing interest in doing all those things. Those are early signs of mental. I won't say mental illness, but those are signs to look out for, that there is a problem that is about to be formed.
So, what of someone that is into drugs, right? Is it a sign, or someone that is into substance abuse? Is it a sign of mental illness? Because I know, okay, let me put it this way. I know some people, all of a sudden, they just start taking some, certain kind of substances, even if it's not something that they are used to, or even if it's not something that they should take. So should I be worried when I see someone taking a particular medication that is not even prescribed? Or just, I would give an example just to be clear. People that are having insomnia or sleep problem, all of a sudden they just start taking sleeping drugs and all of that. So should that be a sign to look out for?
First of all, self-medicating is very bad. Because insomnia, some people just have insomnia as a problem, and insomnia can be comorbid with a form of mental illness, let's say depression, like I earlier stated. So if you notice that somebody all of a sudden starts self-medicating on sleeping pills, it's something to be concerned about, because obviously that's a problem. The person is finding it difficult to sleep, and the person is trying to find a means to sleep. And so you also highlighted substance use. For some people, okay, so let me take myself for an example, right? I don't use cannabis, right? And so all of a sudden, maybe my loved ones start noticing that I've started using cannabis. It's something that they should be worried for, because this is something I don't do before. And then I started doing it. So two things are involved. Probably I started associating with the people with peer pressure, or people that already use substances, and then I feel like, okay, I want to feel among, let me also use. Or it could be that I have a problem and I'm trying to use the substance as a coping mechanism to solve my problem. So I could be depressed, for example. maybe I ate breakfast. Let me say somebody served me breakfast, and I'm trying to
breakfast in what sense?
like the heartbreak. You get it? Like I was saying, let's say on Valentine's Day now, my mates are doing thank you, baby. Oh, and then my own Valentine's message is, babe, I'm not doing it again. I'm sorry. Like, do you understand? It can't work. And I'm thinking, it's enough for me to go and buy 1 or 2 bottles of alcohol now, just to, do you understand? Just to step down so that I can understand the meaning of the message. If there is maybe I'm not doing again means I'm not available for today's date. You understand? So yeah, so I'm going to get alcohol and drink to clear my mind, right? But when now after that day now, and I clear my mind and I find out that this breakup is here to stay, and I noticed that when I took the alcohol, I didn't cry. I'll feel like, okay, maybe the alcohol is going to help me cope with the emotions that comes with breakup. And maybe over time I start using alcohol because I'm trying to avoid crying and feeling emotionally down. So yeah, that's something. So most people use substances because they use it as a form of coping mechanism for whatever challenges that they are going through. So it's something to also look out for.
To add, one of the early signs of mental illness is we do have a poor hygiene. You discover someone that's mentally ill, they begin to withdraw. They don't take good care of their health, of their hygiene as it's supposed to be. So another thing we have is also poor decision making.
That's true.
They are unable to make rational and good decisions when they are faced with certain situations. And something else we also have is the inability to cope or adjust to stress. Maybe if you're a type that used to go to work from 6 to 7, then on some particular day you're unable to cope to those normal stresses of life you've been exposed to before now.
So all right, so do you also know that risky sexual behaviors are also symptoms, like signs of mental illness? So somebody that really, so for someone who, maybe has been upright, church going and all of that, and all of a sudden the person is having multiple sexual partners. Like what's that? There's a movie we used to watch then, I think Keziah or something. There's something they used to say,
I remember
like,
that movie.
Exactly, like dripping, exactly, like that was that was a mental illness. I don't know if you really saw that movie.
I saw it.
The lady was, having different it's a form of mental illness. So
see a therapist ASAP. Thank you so much for that beautiful response. So Nurse MD, okay, talking about the concept of self-care, what are the significance of maintaining good, of self-care in maintaining good mental health? People, a lot of times people usually joke with this self-care thing. You see someone working 9, or let's say working 6 to 6 or 6 to 12 a day, and you're not getting enough rest. You're like, it's like your battery is drained. So can you tell us the concept, the importance of self-care in maintaining good mental health?
Okay, so when we talk about self-care, it has to do with the ability of an individual to take care of their health based on the information available. That's for self-care. Now, looking at the concept of self-care, it involves the individual, the families, the communities working together in order to prevent illness, promote and maintain good health, and also cope with the disability or illness in which they have. So that's it. So, and also one of the concepts of this self-care is, aside from we have the physical, the psychological or the emotional self-care, the social self-care, the emotional and other aspects of self-care. If you look at the physical health, physical self-care, that has to do with the hygiene of the individual. How do they eat? Their hygiene. How do they take care of themselves? The food. How do they eat?
How often
do they sleep? Yes. How often do they rest?
Because I know some workaholics.
Yes.
Right? They can work from Monday to Sunday.
Exactly.
Monday to Sunday, back to back, without resting. And I'm very sure that it will definitely affect their mental health.
Of course, it will. Okay. Also, people, do they involve in physical activities? Do you carry out exercises? That's for the physical. Then look at the emotional. How do you deal with emotional stresses? If someone abuses you, if someone looks down on you, how do you cope with it? So these are all the things that also affect we individual. We also look at other aspects like the social. You see people like the way they economy is and all the stuff like that. You hear of things like bullying. I have low self-esteem. People just coming out with different I'm anxious and stuff like that. How do you adjust to all these stresses once they come to, or once you experience it? Look at the financial aspect as well. You see people, they think the money you earned, with the increase in the dollar and everything, the money you earn is not enough for you to take care of yourself, to pay your children's school fees, to provide meal, 3 square meal, to even pay TP. With the high cost of everything, the money is not enough for you to pay TP and all this stuff. So now, how do you cope with this? For the physical, it's for you to take good care of yourself. You eat well, you exercise well, you go for regular checkup. Mental health is a respecter of no man. If your mental health is down, every other aspect of health will definitely be affected. That's how mental health works. Then we move on to the emotional. If you're having issues, it could be abuse, it could be bullying, it could be domestic violence, any forms of emotional abuse. There is someone you always trust. One person is trusted, someone you can always walk up to. You share a problem with. I'm having this, I'm facing this. How do I go about this? If they are unable to help you, you can always meet a psychologist. You go to the hospital, you meet a psychologist to be able to know how to go about it, to counsel you and help you get out of that situation.
Thank you. Yeah, risky sexual behaviors are also forms of mental illness.
So these are some of the signs people should look out for. Thank you so much, Nurse Andy, for that very insightful response. Okay, so to you, our clinical psychologist, Zini, I would like you to share, to tell us how individuals, friends, family can support someone who is struggling with their mental health. And you can, from there, you just tell us how therapy works, because I know after knowing how to support someone that is down with a mental health challenge, they will definitely would like to go for therapy. So how does this therapy thing work? And what should people expect when seeking therapy for the first time? Mind you, I know a lot of people will definitely have a lot of expectations, when it comes to first time therapy. It will be like, okay, once I've seen the therapy once, I'm not going to be seeing this therapist again. Does it work like that? So I would like to hear from you.
All right, yeah, so you asked about support for people that are battling mental illness, right? So yeah, let me also add that for someone who has mental illness, I like to center on depression, because I know that when you come online, we see people write things about, I'm depressed, I feel sad. Even those that are not depressed, do you get like a little bit of sadness, I'm depressed. And then the new one that they formed is OCD.
Wow, yeah.
I have OCD, and I'm wondering in my head, babe, do you know what OCD is? But then, anyways, we will do like a talk on OCD so that people would stop claiming mental illness, because OCD is a mental illness. It's not cruise. And you get
like,
it's not
this Gen
Z thing and all of that. You get the
Yeah.
gist, right? So it's not cruise, it's nothing. OCD is a mental illness. It's a severe one at that. But then back to the question. So I wanted to say something about support. So we all know that for people that are severely depressed, they usually like to keep to themselves, right? And so if you're a family member and you notice that, oh, this person does not want to interact, and you be like, okay, I've tried my best, I've done my part, she doesn't want to talk, she's feeling pompous, because I know some African parents will be like, oh, you don't want to talk to me, I'll be okay, I've tried, I've done my bits, you're feeling pompous, and that's not the time to withdraw, because the person is in their moment, and that's when they need support more. So yeah, we should always try to show support, especially when we notice that our loved ones, friends have not been reaching out. You don't have to wait until you get a text from someone, because Nigeria is too hard already.
It's too hard, my
and
sister.
A lot of people are going through
A lot.
There's nobody, even the richest person is going through something in this moment. So yeah, everyone is going through a lot, and it only makes sense that we try to be our brother's keeper by always reaching out, showing support, calling once in a while and all of that. I know that some people have their bad parts, they don't like to call and all, yeah. But then another way to show support is if you notice that someone's self-care, like she mentioned, has diminished, right? You don't have to wait and say, okay, you are too dirty, you're supposed to have had your bath, you just ate and you left the plate here. It won't take anything to show that support. Emphasis on support. Support will come in different form. Oh, have you eaten? Oh, I know you're too tired to take the plate to the kitchen, I could help. You know, all those type of form of support. Oh, you've not had your bath.
Why trying to reach?
Why trying to exactly? Why trying to reach out? Oh, you've not had your bath. Let me help you. I could scrub your back. Like, you know, talk to the person very nicely. And this is where I'm going to talk about empathy, because I don't know, Nigerians, in like most Nigerians actually, they lack empathy. And empathy doesn't have to be, oh, I don't have money to help. Empathy can go a long way in the simplest of things, right? And this is the point where you know somebody is battling with something. A little bit of empathy will work. That's a way to show support. And another one would be you know that, you know, okay, so the person has opened up to you and then you are giving the whole advice, right? And you're advising, but you know that beyond advice, the person may need financial support. And then if you're in their capacity to assist the person, why not financially assist? Why would you just sit somebody down and then the person is talking, oh, my business has not been going well, and you're like, oh, sorry about that, Nigeria is like that, sorry, to get better. But you know that this person actually needs money to boost the business, and you have the money. Why not try to, you know, help financially? And then you have people that, so support can come financially, even praying for the person can also be a form of support. Then also talking about, so having exhausted all these forms of support and you feel like the person really needs to see a professional, and that's where you now bring the person to Serenity and Purpose Behavioral Healthcare Services. We have professionals that can help with any form of mental illnesses. We you know, we talk about and we treat all forms of mental illnesses. We are not limited to only substance addiction and all, depression and all of that. And there's one thing I want to say. So people don't know that there is eating disorder. Eating disorder too is also a problem. So I remember
someone that is a foodie
like me now, tell me to my face. So yeah, I saw my name with your food chest. So yeah, eating disorder is also a form, right? So I made a post one time and I said, oh, I have a bad habit, and yes, the nurse can attest to that, because I go upstairs and the first thing I take is toothpick. And it's not like I'm picking, even if I'm not eating, it's not like I'm picking my teeth, for God's sake. I'm chewing it.
That's eating disorder.
I don't understand. I swear. So you know what I told myself? I told myself that, okay, maybe I'm trying to lose weight. Maybe I'm trying to condition my brain to feel like I'm just eating. That's why there's toothpick, but I don't feel hungry over there. I feel like it's a problem. And some people, they have, oh, pregnancy cravings. Everybody hides on that, oh, pregnancy cravings. I want to eat ice block. I want to eat chalk. I want to eat ice block. You get, like, I want to eat chalk. I want to eat, you know, the lamest things that are not adding nutritional values. So that's where pickup comes in. All right,
some people go as far as to eat rock. That's the kind of cravings they have. Someone like me, I do eat ice block. I wasn't pregnant to do, but I just had that cravings for taking cold water, eating block. My mom, at some point, my mom was shouting, so like, what is wrong with you? Yeah, you're not supposed to do this. I was like, oh god. So it was difficult at first. But with time, I just had to gradually change.
And that's a disorder called pica, because pica is a eating disorder where you eat things that are not adding nutritional value. Exactly. So for me now, hey, I feel like maybe as a therapist also needs therapist.
Yeah, therapist needs a therapist. Like I said, mental health does not discriminate.
Okay, so imagine a therapist going to meet a therapist. What's your problem? I eat toothpicks. Oh my god. So yeah, basically that's just what it is. Professional help regardless. As simple as eating toothpick. Maybe I need a professional help. Now also register myself in Serenity for another therapist.
I'll be like
okay, all right. So that's on support. And okay, yeah. So your other question was about treatment, right? Okay, so yeah,
how does therapy work?
All right, how does therapy work?
What should people expect when they come for therapy?
Okay, so yeah, first of all, as I already said, having exhausted all the forms of support and it's not working, I feel like I want to seek professional help. That's where, you know, coming to see a psychiatrist, come to Serenity and Purpose Behavioral Healthcare Services and all, right? So yeah, so first of all, when you come pay for consultation and all, and I see you, or the psychiatrist or another therapist sees you, the first question that we tell you is, okay, so our first meeting is all about assessment.
Okay.
So the assessment literally is just me asking you some questions. We call it Socratic questioning. I ask you questions and you tell me. It's a structured questions actually. I asked your presenting complaints, your symptoms and all of that. So basically the first meeting, the first section when you see a psychiatrist or a therapist is assessment. So you don't expect that you are seeing a psychiatrist for the first time and the person is already giving you solutions to your problem. Mind you, I don't know what your problem is, and it only makes sense that the first time that I'm seeing you, I get to know about your problem, right? So yeah, basically that's just what it is. And so you asked about therapy. So therapy, yeah, so psychotherapy is more like a talking therapy. And so it's not like we just sit down and we talk. We talk based on, facts. So we have some forms of psychotherapy. We have the cognitive behavioral therapy. We have the acceptance commitment therapy. We have the DBT. We have, a lot of therapies and all. Like I said, assessment. So having done assessment, I would know that, okay, so this is this person's presenting complaint. What type of therapy would I use for solution? It's just the same way you go to see a doctor, you say you have malaria, and the doctor will say, okay, you need anti-malarial drugs, right? So basically that's just what it is. And so for cognitive behavioral therapy, what it just helps to do is restructuring. So for somebody that has depression, maybe for example, depression because somebody broke up with you, the first thing I would say is when it comes to cognitive restructuring, we are talking about your automatic thoughts, right? How do you see yourself? How do you see people? How do you see the world? Because if you see yourself as being beautiful, for example, I don't want to delve into it. I'm just, scribbling on the surface and all. So if you see yourself as being beautiful, right? Why would you be bothered that somebody broke up with you? It's just, do you understand? So you get it, right? So, like I said, cognitive restructuring, this is how you see things. We try to help you see things on a professional perspective. That's just limited to depression. And like I said, don't worry, when you come to Serenity and Purpose, you get to know more about this thing. But therapy is very good because, like I said, it's not just about me just trying to be a motivational speaker. It's not the regular motivational speakers you see online and they'll tell you relationship experts. So this one is, we are following a specific pattern, right? And it's facts. It's theoretical, it's facts. So CBT is facts. ACT is facts. It's evidence-based. It's facts. All of that. And so when you also come, we do assessment, like I said. So we also try to do, okay, if it's depression, and you're just telling me, oh, I feel sad. I'm not going to say it's depression. I'm going to give you some, some things to do. Some
people actually self-diagnose.
Exactly.
So what's wrong with you? I'm depressed.
You get. So even when you come to me as a professional and tell me that you're sad, I'm not going to say, okay, because you're sad, you're depressed. I'm going to give you some assessment tools. Let's say, for example, PHQ, BDI. So when you feel it, because there are like some scoring patterns. So when you meet the scores that would now say, okay, you have mild depression, you have moderate, you have severe, and all of that. So you're not just coming to say, I'm sad, and then me as a psychologist, I'm saying, because you're sad, you're depressed. You get it?
There are certain criteria you have to meet before we diagnose depression.
Exactly. And then, thank you. And so as with psychologists, we use the DSM, right? So, like even when the BDI says mild depression, we refer back to the DSM because for depression, for we to say you have depression, you must have been feeling a particular way for more than 2 weeks, depending on the type of depression you want to be diagnosed with. For some, it's more than 2 months. So so like I said, you have to come first, see someone, and then get your diagnosis. Thank you.
Wow. Okay, thank you so much, Saigzini and Nurse Andy, for that, very wonderful answers you gave. Now, I would like us to talk about something very important. In fact, this thing has been bothering me so much because I see it happening every day, and I'm like, what is going on? I mean, so how do cultural factors influence the perception and treatment of mental health care? Because I know there are some times when someone is presented with a particular mental illness and one person is saying, you know what, let's take this, let's go herbal, let's give this person herbal treatment, the culture, let's do 1 or 2 things, or let's kill 1 or 2 goats. In fact, some people would say we have a spiritual house, let's take this person there, tie the person leg and hand and all of that. Then the other person is now saying, no, this person actually needs help, this person needs a professional, this person, and probably because that person is knowledgeable about how to go about mental health challenges. So how do cultural factors influence the perception and treatment of mental health challenges?
When we're looking at the cultural influences, we don't just culture. One thing we need to understand first is that we humans, we evolved from somewhere. We had a system before all these modern medicine, lifestyle, and stuff like that. We here in this particular aspect of the world, now the Nigerian, we had certain beliefs prior to these illnesses we are now being faced with. Like if you go down and you discover that there are some people who believe that, when I talked about the misconceptions, I mentioned people believing it could be caused from disobeying the gods and stuff like that. And one of those beliefs is that if someone has mental illness, the first thing you need to do is take them to Dibia, you take them to the traditional healers. Yes, that's what people think. Once you take them there, they'll be able to get better and they'll be able to get healed. You see, when someone has this idea that maybe it could be spiritual, the first thing is you take them to the church, let the pastor do their own stuff and pray and stuff like that. Those things begins to hinder the knowledge which they're supposed to have about mental illness. Another thing we also look at is poor knowledge. Some of them are not knowledgeable that mental illness can be managed by professionals. So they kind of like feel whatever that has to do. Even there are cases where we've had patients' relatives coming to the hospital to ask us if they can buy agbo for the patient
while the person
is being admitted. Yes. We tell them no, it doesn't work that way. Just let us handle the problems professionally. That's what we've even had cases where patients sign out lama that know that the problem is caused by spiritual, that they are being attacked, that they need to see a pastor, that they need to see a go to the village. We've had cases where patients even want to sign out to go to the church just to go and see the pastor so they can help them. So these are things that hinder mental illness treatment. I've forgotten the question. Sorry.
You mentioned something about people wanting to go to a church or see a pastor or something like that. So doesn't that mean that if I have someone that is presenting with a mental health challenge, I can't call my pastor to or I can't take the person to a church for prayers? So because that's what it's sounding like to me.
So when we talk about going to church, we are not actually discouraging people from going to church or stuff like that. It's also a form of therapy, and we call that spiritual therapy. It has to do with you referencing a higher power, someone you seek refuge in, someone you have faith in. You believe that when you reference this particular deity, you have this fulfillment, you have this peace in you. You could be, it could be Islam, they have a higher power they reference. Christians have who they reference to. Traditionalists as well have this higher power. They do make reference to maybe when they are faced with one challenges or the other.
All right, so like she has rightly said about the referencing to a higher power, and that's why at Serenity and Purpose Behavioral Healthcare Services, we try to infuse the place of spiritual therapy in our activities. So yeah, we have a place for the pastor who is also a therapist come in to intimate our patients and even our outpatient on the place of spirituality in all of these things. So the place of spirituality cannot be overemphasized. But what we are trying to say is do not take one for the other, right? So when it comes to mental health illnesses, it only makes sense that you seek professional help, right? First of all, seek professional help. And that's why outside mental health illnesses, when it comes to health in general, some people always take the place of one for another. So you know that you're ill, right? And then you're taking it all spiritual and all. I'm not saying spirituality will not work, but then I'm saying, how about you take, medical treatment alongside while your pastor is praying or your imam is praying for you, right? You take the medical alongside it. Hold on to the two, right? Instead of holding on to one. So if you believe that church does it for you, even at that, seek medical help. So whilst the medical help is working, your church belief too can also work for you. And so, like I said, at Serenity and Purpose, we also hold that. And then that's why we have the spiritual therapy and the normal psychotherapy. So yeah, it works.
So lastly, before we call it a day, so what would be your advice for people who tries to manage chronic mental health disorder at the comfort of their homes?
Okay, well, to be on the safe side, it's not even advisable to manage a mentally ill patient at home. So it will be much more preferable you bring the person to the facility where the professionals can do their job. In terms of managing a mentally ill patient at home, you may end up complicating the issues. You can imagine someone who is depressed and at the same time they're having diabetes, that's comorbidity, having more than one condition presenting at the same time. You could also imagine someone who is maybe having anxiety and at the same time they are being exposed to a medical condition like hypertension. So in the course of you managing this mental illness, at the same time it could also complicate the other medical conditions the person is having. So when you bring them to the facility, we the professional don't just focus only on the don't just focus only on the mental illness. We also focus on other aspects as well. Like if you bring them to Serenity and Purpose, we do carry out certain baseline investigations for our patients to rule out other forms of medical conditions they may have.
Family member, or if you know someone that is battling with mental illness, like she has rightly said, it only makes sense that you take the person to a professional who is his or her specialty in treating illnesses like that. So you take to professionals for treatment, and we at Serenity and Purpose, we have professionals who can also help in illnesses relating to mental health. So Serenity and Purpose, we are open to everybody, very affordable, very accessible, right? So on the mainland actually. So you can always come to Serenity and Purpose. Like I said, it's very accessible to everybody. We also run online sections, so if you feel like you want to talk to somebody, you can reach us on all our social media handles, Serenity 4P. So also, if you want a VIP treatment, if you feel like you want VIP treatment, we have a VIP section where you can also get the treatment that you want, like a home away from home, right? Yes, a home away from home. So it's very, very conducive, very accessible, and somewhat affordable too. So we are open to everybody. We are open to the middle class, we are open to the high class, we are open to the low class, we are open to the mid, to the on top classes. So everybody, we are trying to make mental health accessible and affordable to everybody. So whichever class that you fall onto, online class, offline class, all classes of people, we are here to reach out to everybody.